Autism and Aspergers. Autism and Aspergers are both classed as autism. Both diagnoses are lifelong and can be noticed in children as young as 12 to 18 months old. Asperger's is considered a less severe version of autism, as with Asperger's there is often no language delay and good cognitive skills remain present. Neither autism or Asperger's are illnesses. Instead, they are classed as neurological development disabilities, and these vary from person to person in severity and the effect they have on the individual's life. Autism and Asperger's is often noticed in young children, and this is due to behaviours that they display. Some behaviours could include flapping, rocking, repetitive movements, generally not smiling, and being easily upset by certain smells or tastes. Girls can often hide their symptoms much easier than boys, as they tend to be quieter when they're suffering with autism or Asperger's. But during a child's life, up to young adulthood, autism or Asperger's can be a formal diagnosis. In some diagnosis techniques, brain scans are conducted to note any differences in the shape and structure of the brain. There's no clear set reason why some people have autism or Asperger's and some people don't, but some recognised causes for both conditions can be inherited due to genetic mutations, environmental factors, viral infections, certain medications, or complications during pregnancy. So as we said at the beginning, both conditions can result in an individual life in a different way. Some ways which are easily noticeable are communication. People with autism or Asperger's can struggle with communication with peers, with colleagues, with the general world around them. They can struggle to understand complex situations, and they can find general social interacting a challenge. It can be difficult when communicating with somebody with autism and Asperger's because they may take what you say very literally. For example, saying, "Oh, break a leg," meaning good luck, could be taken literally. People with autism or Asperger's need varying amounts of support, and it's our job as carers to recognise what each individual person requires, not generally, but specifically. At EGS Home Care, we are really passionate about person-centred care, and our assessment process is really thorough because of this. What needs and wants that are identified in any individual's care plan at EGS, you can be sure if you're following that, you are meeting the requirements for that person's health and well-being. These needs can vary from person to person in intensity, in need, and in specifics. One thing, however, which is consistently helpful to individuals living with autism and Asperger's is a sturdy, reliable routine. Often, when things change for people with autism and Asperger's, it can leave them feeling unsafe and confused and can alter the way they focus and they feel calm. Very commonly in autism and Asperger's, they are very strict focal points. Again, they vary from individual to individual, but regardless of that variation, the intensity is fairly consistent. For example, one person may focus on the front door always being locked in a certain way. To that individual, if that door is not locked in that certain way, everything else around them doesn't feel safe. It throws everything else out of sync. Many people with autism and Asperger's are really high functioning, and they have extremely good observational skills, and they pay attention to detail. They absorb and retain facts and have deep focus. And within this focus, they want their preferences to be stuck to and to be correct. They have really good visual skills, and they develop expertise into managing their own environments and situations. So when we're providing care for people with autism and Asperger's, we need to be mindful of that and make sure we're paying really good attention to their preferences, their requests, and their needs. To help somebody the best that we can, we need to recognise what may be a trigger to somebody. A trigger is a term that's used to highlight a specific word, a smell, a place, a sound that creates a reaction in that person's brain, which then is displayed to others as some extreme behaviour. An example of a trigger could be when the BBC News comes on the television. That introductory sound and that title, that what's about to be played, could cause that person to become very, very distressed. An easy way to prevent that trigger from being triggered is to not have the television on around the time the BBC News plays. It is our job as carers to make sure we're aware of those triggers, we respond effectively and appropriately to those triggers and empathetically, and we make sure that we're always being responsive as a team by communicating any changes and any incidents as we go along the way. As we said, the best way to provide clear and effective care for somebody with autism and Asperger's is to be concise with that routine and stick to it. Support them within their daily activities and help them to manage social interactions. Bring outside help in as and if and when required. Be consistent and provide constructive feedback, and be careful with changes to the routine. Let these people that you are caring for rest and break from stressful situations. As we said, be empathetic. Think about how would you feel if that was you in that situation. Don't make judgments, and don't mistake rude behaviour as rude expression. It simply could be that this certain subject is difficult for this individual and they don't understand how they can best communicate it to you. Help them to stay in their chosen environment and to feel safe in that environment. And for us at EDS Home Care, that's people within their own homes. In summary, what's so important with all individuals that we look after, and in particular those with autism and Asperger's, is be mindful of their routine, be mindful of their environment, be mindful of their triggers, and be mindful of their limits, and work within those, support them within those, and care for them within those.